and control fall preparation. We're also going to talk a little bit about winter preparation. And my name is Melanie Rhonda, and I work at IPRO. I'm a nurse and an infection preventionist. So, we're going to go over infection prevention and control plans, some common winter fall preparations might want to consider, determining the elements of your IPCP, so making sure you have all of the elements addressed in your plan. Discover outbreak management. Many of you may feel very comfortable with outbreak management since you've been dealing with it very frequently with COVID, but we really want to talk about all the components and what if it's not COVID. Consider the facility immunization campaign. We have a lot of information about the immunization campaign and also some up to date vaccine resources. So, if you're a new administrator, a DON, an IP, the for this facility, it would be really important for you to take a look at your annual assessment for either your facility assessment and also your IPCP annual review. You really want to understand what was said about your facility last year and what has changed over this year. Maybe you've developed a new service line. And if you did, how has that been addressed in your planning and policies and procedures? What should you do to enhance your current plan? It's really a good time to really look at your plan and make sure it has all the proper elements to what is happening in your facilities now. Make sure you include your community risk factors and understand the level of communicable diseases in your area. You can reach out to your local health departments to understand if there are pockets of different communicable diseases, such as tuberculosis, influenza, COVID-19. We see COVID-19 and influenza kind of up and down. There are areas in New York State that there's a higher risk of tuberculosis. So being aware of what's happening in your area is very important when you're doing your planning. When you're doing your facility assessment, and looking at the annual review, you want to incorporate the interdisciplinary team. This is not the time for one person to sit down and think about, geez, what's happened over this last year? Oh, what are we going to do differently? No, I think everything's okay. This is the time to bring everybody to the table and have a hard conversation about what's working, what is our risk, what happened over the last year that maybe we have some opportunities to improve, and how should we establish some new policies and procedures that are going to address those things. And again, I talked about what's unique, or what was your new business plan, but what is unique about your population? So think about that. Do you have a dementia unit? Do you have a vent unit? Are you caring for pediatric patients? Your situation may look different than others. So you want to be very aware of what your unique population is and how you want to address that in your risk assessment and your planning and policies and procedures. Um, and also, so I'm saying the annual risk assessment, you want to make sure as the IP that you have had a conversation with the administrator and director of nursing to ensure that you have implemented policies and procedures that match that facility risk assessment. So let's talk a little bit as the infection preventionist or one of the people in your building that infection prevention really matters to you. I know some of you are from assisted livings. So somebody needs to be thinking about the infection control program in your building. But it's really important to start thinking about what's the impact of fall and winter for us. And the first thing I think about is taking a look at the immunization policies for residents and staff, and what needs to change in those policies, and what do you need to prepare for this year's program. What's new? What's different? What, from a regulatory perspective, has changed? What has changed from a guidance perspective? So, ACIP, the You want to make sure that you're paying attention to what the most recent recommendations around COVID, influenza, pneumococcal vaccine, RSV vaccine, and ensuring that your program incorporates that. And if you are in assisted living, how are you bringing the vaccines to the residents? Are you using their primary care provider? Is there a way for you to connect with a clinic, a mobile clinic, so that you're able to get the vaccines at ease for your residents? So it's this is also the time to be very proactive with your staff, your families, anyone who's coming to your building about signs of illness. Everyone needs to know, what are you concerned about? When do you need to know something? What type of training and education are you trying to do to be aware of different types of illnesses? Visitor and staff screening really falls in line with that. So maybe there's been a lull in COVID cases, but this is the time to be considering, how are you communicating with the visitors and staff? If you are symptomatic, you are not coming to work. If you are symptomatic, you are not coming in to visit. And we have some alternatives to visitation if you're coming to, if you really want to see your loved one, or if we you really can't come in to see your loved one because you're not feeling well, this is how you go about it. So we had a lot of great procedures that came into place while in the height of the pandemic. This might be a really nice time to be very transparent with your families, get out there, talk to them about different ways of visiting, how you can partner with them so they're still connected with their loved one. But if the loved one is ill or they are ill, that they're not coming to the building and potentially spreading virus. So I just highly recommend that now is the time to talk about that. So that really just talks about communication. We learned through the pandemic that one of the most important thing is to be transparent, to be aware of what's happening in our community, to make sure our residents and our families and our clients are aware of how we manage certain things. So preparing for the fall and winter, when I think communications, how are you talking about immunizations? How are you talking about outbreak management? How are you managing the communication about signs and symptoms of illness? What kind of signage do you have up for visitors to be aware? Being very aware to talk to your staff. I know I've heard this so many times with staff that I just had allergies. I thought it was my asthma that was happening, and then there's an outbreak because in fact somebody came to work with the symptoms of allergies, which was COVID or RSV or influenza. So just being out there and communicating and talking to your staff, so important. So then I wanted to just bring forward some elements that you're responsible for as the infection preventionist, or if you're the administrator or the DON, the elements that need to be incorporated in your infection prevention and control plan. Now, these elements really do translate if you're working in an assisted living as well. You want to make sure you have a process to prevent, identify, report, investigate, and control infections and communicable diseases for everyone. So you're not just responsible for the residents, you're responsible for the residents, the staff, the volunteers, and visitor. This plan needs to be concrete, so you are in protecting all that are coming to the building. So we're going to touch on some prevention focuses. I'm sure if I asked you right now how many different ways you are preventing infections in your building, you're going to talk about, you're going to have many different ways. We're just going to touch on a few of them today. That just prevention alone could take several hours to talk about, or even a day. Um, so, with a focus on what you want to be considering for fall and winter preparation, the first thing I recommend that you do is pull your policies, pull your procedures. Make sure you are considering okay, this is what the policy says. I'm going to get out there. I'm going to find out what the staff know about this policy, how the staff are managing it. Is it working? Do I need to do education with one or everyone because we haven't pulled this policy in so long. I think another area to be really focused on when it's policies and procedures, how are you communicating to the off shifts or if you have agency? So if you have an agency staff at the bedside, do they know what they need to do if there's symptoms of infection with a resident? Do your supervisors know what the action is that they need to take if somebody's going on transmission based precautions? Do you have cheat sheets out there for everyone who would be responsible for making decisions? So, policies and procedures, like I said, super important. Pull them, start looking at them. I think of one of the policies I would be pulling is my vaccine policies. I want to know what it says. I want to make sure the vaccine assessment, when is it happening and by whom is it happening? And is that still in practice? Do we need to make some shifts? If we're getting a lot of admissions on a Friday evening, who is assessing the vaccines? Is there a second check to that so we ensure that people are being screened and educated and offered vaccine in the right period of time? Um, we also want to pull our standard precautions. We want to make sure staff is aware of when to use standard precautions. We're going to talk a little bit later on about precautions, transmission based precautions, enhanced barrier precautions. This year, enhanced barrier precautions became a regulation. So lots of changes with that. And right now is a great time to be pulling those policies, ensuring your staff is very aware of what they need to do if you have transmission based or enhanced barrier precautions. Immunization campaigns, we're going to talk a little more about that as well. And I really want to make sure I hit home that all of our prevention plans are to incorporate residents and staff. We want to make sure we're keeping everyone safe. Um, Hand hygiene. When I think of fall and winter preparation with hand hygiene, I think of the cold and the changes to people's skin and the opportunity for skin breaks and the staff to have um, open areas on their hands because of that. It's a good time for you to look at your products for hand hygiene, either alcohol-based hand rub or your soap, and having a lotion that would work with them. And I always like to put a plug into how are you including your visitors and your family. So if you are putting out some training material or offering some support to your residents, have you asked a resident to review it and does it make sense to them? Is it in a language that makes sense? Is it in a font that they can read? Would they change some of the wording to make it more connecting to them? Could visitors get involved in some of your letters that you're going to send out or some of your training? Could a family member or a resident become your spokesperson for your immunization campaign or stay home if you're sick campaigns? How can you incorporate them in the planning part? So another area, you all are working in long-term care in some fashion, or assisted living. Respiratory etiquette is clearly an opportunity, teaching residents, staff, visitors what to do to manage a cough, how to cough in your sleeve, how to cough in the tissue and dispose of it, making sure there's a place to dispose of the tissue, provide signage to alert those entering the building to refrain from entering if they are coughing, encourage other means of visitation. We talked about that already. This link is a nice download for respiratory etiquette. So you will get the slide deck and you can find that, and you may want to use that for training in your building on the respiratory etiquette. So, hand hygiene, you really can't talk about infection prevention without talking about hand hygiene. And I do think sometimes it feels like we talk about it so much, but hand hygiene is the first line of defense from spreading infections. So, alcohol based hand rub. Ensure alcohol-based hand rub is widely available and stationed conveniently for staff. So that is a question. If you walk away today with one thing, go out and ask your staff, is there any other places it would be helpful to have alcohol-based hand rub to make it easier for them to clean their hands? You can still see if you look at deficiencies that hand hygiene remains a common deficiency. So there's always opportunity to improve on hand hygiene. And one of the areas is making sure we have dispensers in the right place. So dispensers at the entrance of the rooms in semi-private rooms, is there a location inside that allows the staff to be able to clean their hands before caring for the next resident? So you have to determine if putting alcohol-based hand rub is safe for your building inside a room, but just thinking about the staff that there's 2 semi-privates, how are they cleaning their hands before they get to the next person or they helping the person in the room? Provide individual dispensers for those occasions where staff will not have access to a secured dispenser. And I just like to put out there when we're talking about alcohol based hand rub, be aware of the fire codes and work with your facilities department related to the fire codes and how many alcohol based hand dispensers you can have in the area. So hand washing is really about the process. It's very important that people know how to properly clean your hands. Most facilities do some training on soap and water washing and watching people do soap or water washing and all the things that you have to do with that, with the scrub and drying your hands properly and shutting the faucet off with paper towel, but that it is all technique based. So identify the locations of the hand washing sinks, and I think that's a challenge in some facilities, depending on how old the building is, where you might be able to find a hand washing sink that is not occupied. So if you again you're in a semi-private room, one resident is in the bathroom, how are you going to clean your hands if you're working with the other resident? Educate staff when they need to soap and water wash their hands. We did an assessment a while back for a different project. We did identify this opportunity that there are people, staff that are not aware of when they have to soap and water wash their hands versus the alcohol based hand rub. So, doing a training program in the fall is a great time to talk about your hand hygiene process, policies, procedures, and getting out there and finding if there's new locations you need. Determine if soap and paper towels are being stocked as often as necessary. So that is an area we have found. Oh, I've learned from some facilities that's the issue where there was deficient practice. The CNA did not use the sink because it was not stocked and they didn't have time to go and stock the soap and stock the paper towels. And there's even a process of where you find the soap and how you put the soap in the dispenser. And it becomes complicated at times. And that can be an area where you have a problem. So don't forget to test your process. So let me talk a little bit about that. So if you it could be it could be the soap or it could be alcohol based hand rub. If you have a alcohol based hand rub that has a locking mechanism on it, somebody needs to store the key to the lock to it. There needs to be a place where you're storing the alcohol based hand rub. Somebody needs to be able to find the key, find the hand rub, know how to install it. So often there's something that needs to be popped for the air to go into it. Sometimes the dispensers need batteries where the battery is going to be stored. And you may have felt very confident about your process and developed it and thought, this is going to work. We're going to lock the alcohol based hand rub in this closet. The batteries, the unit secretary has the batteries, and the key is over here. But in reality, when a CNA on at 4 o'clock in the afternoon is trying to find all this equipment to make sure the alcohol based hand rub is working, they can't find it all. different things are locked up. The batteries are locked up in a drawer, so you have to find a supervisor. I'm sure you can see all the different ways that process might fail. So we talk a lot, work IPRO is a quality improvement organization. That's one of the areas we really want you to test and consider. Is your process working? And also, when you're planning new construction or remodeling, making sure you're looking at what you need for sinks and because it is still a healthcare facility. So cleaning and disinfecting. We definitely can't talk about infection prevention without talking about cleaning and disinfecting. Fall is another great time to look at your facility-wide cleaning program. Really partner with your leadership and invigorate the focus. And when you're thinking cleaning and disinfecting, you have a lot of areas in your building you have to consider, like linen management, the dietary, how are dishes being done? How are you cleaning the rooms? What about the privacy curtains? So there is so many areas to focus on. Even the cleaning products. What cleaning products do you have out in the primary areas on the units? Do the staff know how to use them properly? Do they know how long they need to remain wet to kill the germs? Before they go and they use it. So that's really important. I think of glucometers. When I think of that, are the staff aware that it needs to sit and dry before they use it again? um, the proper use. So there are products that you're going to use if you have a C. diff room, and then there's maybe products that you're using to clean your tables down. And are the staff all aware of the different products? I think about linen management as a real opportunity too. I was just reading through some surveys and seeing the simple things like the clean linen hit the floor and it was picked back up to be used. That's something that could happen, and we need to be very aware. We're teaching our staff. If it drops on the floor, it is dirty. It needs to be put into the dirty hamper at this point. That immediately means it's dirty. So dwell time, really important. Knowing your terminal clean. What is a terminal clean? Does your staff know how to terminally clean? How are they cleaning equipment from room to room? And what about those folks that are on transmission-based precautions or enhanced barrier precautions? What are we doing about the products going in and out of those rooms? I think during COVID, the height of the pandemic, a lot of folks were bringing in products they weren't familiar with because that was the product that you could get at the time for cleaning. So that's another area to be focused on, making sure number one, the products that you brought in necessity are not outdated and that if they're being used, that folks know how to use them. So that was about prevention. We're going to talk about identifying. So that was one of the other elements in the IPCP plan that you need to be aware of. You need to be identifying. We talk about surveillance. So who in your facility is aware and using surveillance. So who is looking for the infections, the problems, oh, somebody on that unit has a respiratory and then now another person has a respiratory issue or we're seeing some diarrhea happening or we have 4 UTIs. How is the surveillance happening? Who is in charge and responsible for that? And if you're in assisted living, how are you kind of understanding the whole health of your building? What can you put in place that helps you understand who is not feeling well, who's been dining with who's at risk for a respiratory because that person has a respiratory issue? So just really thinking about somebody being responsible and how you're going to be doing that. Assessments on admission. So that's important when you're doing your assessment on admission. Do they have a history of a resistant organism? Do they have are they a sepsis survivor? If they're a sepsis survivor, they could be at risk for becoming septic again. Did they recently have an infection? How often are you doing assessments on your residents? Are you doing them daily? Are you doing them weekly? Are you doing them monthly? And if you're only touching base, that if you're doing a monthly assessment on a resident, are you confident that the staff is aware of changes and then very comfortable to report them up? And we'll talk a little more about that. Employee health, this is really important because we want to make sure that there's a clean process for employees to call in and let you know they're not going to be at work because they're ill. So, employee health is important. The use of electronic health records. So, there's some great programs out there, in the electronic health record also helps you really scan through your residents to see who are outliers with vital signs. Bowel issues, just changes in condition. That's a great way to be looking for issues. Training and education to staff to be aware of signs and symptoms. Like I said, this is the time to get out there. You want to talk about norovirus. You want to talk about respiratory virus. It's really the time. And line lists. And who is responsible for creating a line list and documenting what is happening in the building from infection point of view. IPRO, we actually do have a great line list with some antibiotic stewardship included. So if you're interested, you can email me and we can send you some. So surveillance and outbreak. So be aware of what constitutes an outbreak. Work with your local Department of Health. So you have become very comfortable with outbreaks, but there are other things than just COVID. There's norovirus. This is the time of year where a lot of people bring in food to your building. So thinking about that as a potential risk. For a foodborne illness, just be thinking what constitutes an outbreak and what is different for you. So highly contagious is one case. And then there are things like maybe you normally have 2 UTIs, and then on this unit you have 10. So is this an outbreak that you need to consider? Do you need to take a look at this and do some investigating? Line lists are essential, so I recommend you all are using line lists to document your respiratory issues, any type of infections you have. Maybe you have an issue with conjunctivitis. That can spread very easily in a facility. How are you using morning report and reading notes? Morning report is a great place to start to identify a problem. It's Monday morning, you're in morning report, and you hear 4 people have diarrhea on unit A. What are you going to do? How are you going to start looking at that? You have to be, are you going to close the unit until you figure out what your next steps are going to be? Just morning report is really quite a good way to get some information. So culture of reporting for early identification. So certainly you want to make sure you're making sure you talking to your staff. They are very aware, they're willing and comfortable reporting up that 4 people have diarrhea. This is not, I've been doing this all day. Everybody's going to the bathroom. And then you go to the unit and you find out it's 2 people. But making sure that reporting is happening. And don't forget to be aware of increased call-ins and staff illness. So when we talk about reporting, you have to look at what your plan is. Reporting happens in a variety of different ways. You can report um, the it could be all levels, so you wanna make sure your CNA knows to report to your LPN knows to report to the supervisor's, DON and administrator are reporting to they need to who they need to report, so reporting in a facility can be many, many layers, and do all levels of staff know to report what they see? So if you have an activities person who goes and sees Mrs. Smith every single day, and today Mrs. Smith is acting very different and has pink cheeks and was coughing. Is that person comfortable and knows who to talk to? Or the house the housekeepers, they are wonderful with knowing information about the residents. Are they comfortable to come forward with signs and symptoms? Do supervisors know when to call others and who needs to be called? So that's where I talked a little bit about making sure you have a cheat sheet. If you do not have a regular supervisor on this weekend, how are they going to know who to call and when they need to call? How does your lab report findings? So there's a lot of opportunity to look at the process with your lab. Do they call you if there's an urgent issue? Does it get faxed? Is it going right through your EMR? And is somebody looking at that? How are you finding out unique things with your lab? And if you don't have a concrete process, I suggest you meet with your lab and develop a plan, because that is always a good way to repair the problem. And your lab should be able to provide you a lot of information. And then as the IP, or if you are acting IP, how are you reporting to the QAPI committee? This is really important. You as the IP, if you're in long-term care, you are supposed to be on QAPI and you are supposed to be reporting. So please take time to look at the state operations manual for your responsibility and the QAPI committee on what you should be reporting and what the purpose of the IP in QAPI is. So investigating, gather and review the information. So it's really important that I've always of the philosophy, if I don't see it with my own eyes, I don't know if it's true. So I like to get out there, ask questions, go to the unit, speak to the frontline staff, find out what's actually going on. If it seems like we have an increase in diarrhea, did we have a lot of people that were on the bowel protocol last night? What's going on there? So get out there and be the detective. We are, as the IPs, we automatically become detectives, which has been a fun role to not be trained to be a detective, but suddenly you really start to learn to ask many, well, tell me more about that. Why? Let's talk more. Um, so then, you've done some investigation, you're starting to really think about this, and now oh, is it really an outbreak? What am I going to do? So, outbreak management. What is an outbreak? The occurrence of more cases of a communicable disease than expected in a given area or among a specific group of people over a particular period of time. So, I got this definition of an outbreak from the cdctrain.org. So, you all probably have gone through that cdctrain.org, but I just thought that was a good definition. You should begin to suspect an outbreak or initiate an investigation of an outbreak when, but not limited to, an increase over baseline infection rate is noted, a sudden cluster of infections on a unit or during a short period of time, a single case of a rare or serious infection. So, an increase over baseline infection rate is noted. That could be the UTI that I talked about earlier. A sudden cluster of infections on a unit, that could be norovirus or a diarrheal illness. A single case, well, we react to a single case with influenza or COVID. So, outbreak investigation, you really want to think about the purpose of the investigation, early recognition of potential outbreak to implement control measures, regulations regarding recognition, containment, and reporting. And there are steps in an outbreak investigation. And I'm going to go to the next slide. And this is from the CDC Steps in an Outbreak Investigation Epidemic. Uh, Intelligence Service. So verify the diagnosis, confirm the presence of a healthcare associated infection, alert key partnership, establish a case definition, identify and count cases, organize data according to person, place, and time, conduct targeted observation, formulate and test hypotheses, perform infection control assessment and implement control measures, follow up communication findings, and notify residents and families. So this it's a pretty comprehensive step by step, but if you think about what you would need to do in any outbreak, these elements are part of them. Some things we certainly would know what it means, the case definition. If it's COVID, we're going to easily be able to identify that. But really, if you think about it, we have three, four respiratory issues that we are always looking for. So it could be pneumonia, it could be RSV, it could be influenza, it could be COVID. So how do we narrow down which one it is? And using these steps will help you get there. So I'm going to go back to prevention a little bit and talk about the precautions. It's a good time now, like we talked about, to consider standard precautions. Standard precautions, staff need to be very aware that standard precautions is a base. And if you're walking into a situation that you need to put PPE on, do that so that they're very comfortable that this person's vomiting. I'm going to go in and I'm going to grab a gown, and I'd like some goggles because it's a projectile vomiting, so that they feel very comfortable they can go get what they need whenever they need it. So getting out there and talking about the three different precautions is important. Enhanced barrier precautions. So long-term care only. So it's important to think about long-term care. Enhanced barrier precautions really do two different things. The first thing is it protects a resident that doesn't have a resistant organism, but has a likelihood of obtaining it. So if they have a wound that doesn't have a resistant organism, or they have a catheter of some sort, and they don't have a resistant organ, but they have an entrance to their body, we put them on enhanced barrier precautions to prevent the spread of something infectious to them. And then additionally, if somebody has an organism that could be at risk for others, we put them on enhanced barrier precautions to prevent the spread to others. So there really is two different ways of looking at enhanced barrier precautions. It's protection for all. And I know that there could be a lot of questions around enhanced barrier precautions. It is a newer process that you're using in your buildings. We don't have a lot of time to talk about it today. I will put my email in chat, and you're welcome to email me and see if there's anything I can help with that. So transmission-based precautions is in addition to standard precautions, additional protection actions that are added based on the means of the transmission of the organism. So the organism could spread through droplet. We're going to ask you to put a surgical mask on. If the organism is airborne, you're going to be wearing an N95 mask, and you need a negative pressure room. And then obviously contact. It's heavy. It's not going to, you don't need to use the mask. You need to make sure you don't bring it about on your clothes, so you're wearing your gowns and your gloves. And thinking about precautions, the other thing you can take away today is go out to your units, make sure your signage is accurate, make sure if you have somebody on enhanced barrier precaution, whatever policy you put in place for your enhanced barrier precaution signage, that it's actually working and your staff know what to do when they're walking in. And if you have people on transmission-based precaution, is it the current sign that you are supposed to be using, or is it hanging? Is it in the right place? Do you have all that you need? I have found that for some reason, precaution signs tend to be hoarded in certain areas, and the old ones come up and end up on walls. And so just being very aware and taking a look at that is pretty important. So prevention again. So we went back to precautions, and I want to talk a little bit about vaccines And because that is number one, and well, number two way to prevent the spread of communicable diseases that we have a vaccine for. So we have IPRO has the WAVE campaign, and our slogan is "What about vaccine every time?" So every time a resident or a staff member enter into have an encounter with a provider, they should be screened for vaccines, adult vaccines. There's some great resources on this page, and there's also a 7-part series on motivational interviewing related to vaccines. And what I really like about that series is it's the hard questions that your staff receive when they're talking to residents about vaccines, even areas that are challenging to talk about. So from a political stance or from or just misinformation. So there's seven different options that you can pick to listen to how you may address those areas with a resident or family member. So how does your facility vaccine campaign look? Have you sat down and started planning for your vaccine campaign? And remember, at this point, it's not just about influenza. You need to be cognizant of influenza and pneumococcal, COVID-19. How are you going to address the second dose of COVID-19? And just be really aware of what your facility campaign is looking like. How are you going to reduce the cost related to that? Do you know the billing process? Can you get billing involved with how you're going to bill out for the vaccine? So on the WAVE website, there is some information about billing. And then techniques to integrate into QAPI, your immunization plan. So if something's not working, how do you improve on that? How can you look at it differently? Can you learn what's working in other facilities that might be able to help you build your immunization program? So, when we start talking about vaccines and who might be approaching our residents, our staff, our family, it's really important to educate yourself before you start doing that. You want to make sure you have the most up to date information because you're going to be asked questions. It's guaranteed there are going to be questions when you start bringing vaccine forward. Instruct clinicians to educate residents, family, and staff. So, is it the nurse on the unit? Is your MD part of this? How are you doing your education to your residents, family, and staff? I heard of one facility that really found this very successful way is they started on the unit, then they went to the director of nursing for those that were declining, and then they went to their medical director as the last step. And they had a really high vaccination rate because their questions were answered along the way. So, and they became less concerned about their particular questions related to the vaccine. So document and provide a copy of the documentation. So I think this is really important. As adults, we don't think about bringing our immunization records with us to all appointments, and it is something we need to do because the adult immunizations are so important. We bring our medication list, but we don't think about our adult immunization. And if your resident is going into acute care or your resident's going into home care, they need to know. Every care setting needs to know, have they been vaccinated? So very important to send immunization records with your resident. And just remember, you have to make sure you're storing your vaccines in a proper way, a refrigerator that is large enough to house vaccines. Check your manufacturer's recommendation and temperature during transport. There is a specific website that talks about vaccine storage and handling toolkit, so you can take a look at that. Identify, so using standing orders for administering vaccines. Immunize.org is a great resource for all of you for looking for policies, the VIS, so the vaccine information statements, just different ways of looking for support. Immunize.org is a great place to start with that. So messaging, I'd love if in chat you have some fun messaging that you use to kind of highlight your vaccine program, go ahead and put that in chat. I'd love to hear of your slogan. So IPRO has the wave. What about vaccine every time? We have we can do this, give the boost a shot. So whatever slogan you might be using, that would be fun to just kind of learn. Do you have a slogan? How are you preparing the facility staff and the clinic? Are you reaching out to are you a facility that's interested in vaccinating your families that are coming in? Can you work with your health department, your community health departments to do some clinics so that you have more vaccine uh, herd immunity with your families that are visiting? Maybe that would be helpful. Are you getting some letters out to the families about the importance of being vaccinated before you come to visit your loved one in long-term care and the risk of not being vaccinated? Communication at the bedside, and the CDC recommends the share method, so I'm going to quickly go through that. So share the reason why the vaccine is right for the patient, given his or her age, health, risk, lifestyle, occupation. Highlight positive experiences with the vaccine to reinforce the benefits. So if you're talking about influenza, we've had years and years of influenza vaccination. How is that been beneficial? Address the patient's questions, any concerns about vaccines, including side effects, safety, vaccine effectiveness. So that's where you need to be prepared. If you're the one who's going to be talking about vaccines, be aware and be ready for the questions. Remind the patient the vaccine protects them and their loved ones from serious illness, and explain the potential costs of getting sick, including serious health risks. And one of the areas I've heard is people are concerned about getting vaccinated because they're going to miss a few days of work and they're not going to feel good. But more than likely, if you get influenza, you're going to be missing many days of work and your family events and all the things that go with that. So, right now is the time to be vaccinated before we get into Thanksgiving and before we get into Christmas. Other areas that we've learned have been really successful, vaccine ambassadors, and that does not need to be the administrator and the director of nursing. That could be, maybe you have a wonderful resident that would want to be the vaccine ambassador. That it can be whatever works for your facility. Standardization, make it routine. So that's going back to that assessment. How are you assessing your staff, your residents, and how are you just making this part of the routine? Reminders and re-educate. How often are you discussing vaccinations? And your quarterly MDS review, are you talking about pneumococcal vaccine if they weren't vaccinated? Maybe that's a time to keep talking about it. Motivational interviewing, developing scripts for staff, and that's where I mentioned with the WAVE campaign, you can take a look at the motivational interviewing podcasts and listen to them and see if that could be helpful. We have heard many times that the incentives and rewards with the staff really helped get people interested in being vaccinated. Ease is very important. So making sure that you are in fact making it really easy for people to get vaccinated. That makes a big difference. Vaccine requirements, keeping up to date on the vaccine requirements. You want to make sure you're doing that. Effective messaging delivered by trusted messengers. So, this is important as well. So, if your medical director has just come to work in your facility, you would have to determine if your staff felt that person's the trusted messenger. Maybe it would be somebody else. Maybe they just the nurse practitioner is the one that's there every single day. They're talking to your staff, they're talking to your resident, and that's who they want to talk to. Your residents might want to talk to the LPN that's been works with them every day, gives them their meds. That might be who they trust. So that's important too. Provider recommendation. It is important for the providers to recommend what vaccine makes sense to the resident. And then also always combating misinformation. Be aware of what's out there. Be aware of what your staff is saying with the misinformation and be prepared to speak to that. So CDC updates with vaccine recommendations, what to know. at its October 23rd, 24th meeting, the Advisory Committee on Immunization Practices, so ACIP, reviewed vaccine, disease, and cost effective data and voted to update vaccine recommendations for COVID 19 and pneumococcal. CDC now recommends a second dose of 2024-2025 COVID-19 vaccine for people 65 years and older, and for people who are moderately or severe immunocompromised 6 months after their last dose. So, two for many of your residents this year. CDC also recommended lowering the age for routine adult immunization vaccine from 65 to 50. So that might shift a little bit with some of your staff. So be aware of that too. CDC has the new campaign, Wild to Mild campaign. This is kind of nice. A flu vaccine can take flu from wild to mild. I got my flu vaccine to take flu from wild to mild. So you can click on the link and you can find some resources. So we've talked a lot about prevention and all the different policies and procedures. I think I wanted to just give you a little overview of quality improvement. And one of the areas I like to do is to take a look at the process. So sometimes when I'm a former director of nursing, there were times I believed something was working really well and I was confident that this was working. And what I needed to do was get out there and actually find out from the staff, is this working? So I love this form. It's process reliability. Focus initially on key process rather than benchmark outcomes. Evaluate if staff know the process. That's getting out there and asking. Keep it simple and commit to being a learning organization. So it's not the end of the world if your staff does not know what you thought they should know. It's an opportunity to make changes and train and educate and figure out how you're going to fix this. So focus on the process. If you think a process works pretty well, so you probably have something you say, this is working good. So test 5 attributes. Who does it? When should it be done? Where is it done? How is it done? What is needed to be done? Ask 5 staff to describe these 5 attributes. If 5 direct care staff can describe the work with the 5 attributes, you have good chance to achieve 95% performance and sustain the performance over time. So very good. If they can't determine which attributes they can't describe and develop a simple process for improvement. If they can't determine which attributes they can't describe and develop a simple process for improvement. So it's very important, keep it simple. Don't rely too heavily on education as the fix. So when something's not working, our go-to often is, well, we just need to go back out and educate. It should work. People don't know. We need to get out there and educate. That may not be the problem. You need to get curious, determine the why, and inform staff on the why. Why is this happening? Bring a team together. Talk about the process. Is the process important? Why do we do it the way we do? Do we need to create a different process? And let's just keep it simple. So if we keep it simple, we can move forward and we can create a process that's sustainable. So that's just a very brief overview of a little snapshot of quality improvement that you can go ahead and put in play today. Again, maybe you want to look at your vaccines, your hand hygiene process, um, and you can just move forward with doing something with that. So, all right. Do
Thank
we
you.
have questions?
We do. We have a couple. Thank you for that very thorough presentation. That was excellent. One of the first questions we have, can you provide an example of a line list, please? And I
Sure.
did place our emails are in the chat, so you don't have to do that.
Oh, thank you. So if are you looking for an actual Excel spreadsheet? Often you would lay out a line list and depends on what type of facility you are, how you want to do this. Maybe you have a respiratory